ECHO stands for Environmental Influences on Child Health Outcomes. It's a national children's study organized by NIH. So we recruit women when they're pregnant. We collect lots of data while they're pregnant so that we know what their diet is, what they might have been exposed to in terms of chemicals, how stressed they were during their pregnancy, many, many things. And then we follow their kids prospectively from birth until 21 years of age, I think, once they get out of the adolescent period. iKids was funded 7 years ago to become an ECHO cohort, so we're now part of this huge consortium. Our focus is neurodevelopment, but ECHO looks at 5 different aspects of child development: perinatal, birth outcomes like perinatal health, airway disease, obesity, neurodevelopment, and then also positive health. What are the things that contribute to well-being and positive health outcomes? There's close to 40,000 children in the study now. So we're gradually building a big data set that looks at both outcomes and exposures. And environmental exposures are described very broadly to not just be chemical exposures, which have been the focus for iKids, but also other environmental factors, air pollution, and where you live. Do you live where there's a lot of green space? Do you live where there's a food desert? How stressed was your mom during the pregnancy? All kinds of different factors like that. So we have a lot of surveys that we do. And then we do measurements of the child at birth and follow up with measures of growth later. And then we do in-person visits where there's a series of cognitive and language development tasks.
Touch the picture of Weld.
I think the exciting thing is just how big the data set is growing and how much opportunity that gives us to address research questions with, instead of our 400 children or 500 children, with maybe 5,000 or 6,000 children within ECHO that we can combine and have much more power to look for subtle effects that could be happening from environmental exposures.